breastfeeding, how to increase your milk supply. Nurse, nurse, and nurse again. The more your baby nurses, the more milk your body makes. Don't follow a strict schedule. Nurse your baby whenever she is hungry or as far as she wants, especially the first few weeks of establishing your supply, and offer the other breast when the first is empty. Don't worry. Many new moms think that they have a low milk supply when in fact nothing is wrong. As long as your baby is alert, active, and regular, feeding and wetting diapers, your supply is likely fine. Remember, it can take a few days after delivery for your milk to come in. Meanwhile, your baby gets colostrum, which is the thick first stage of breast milk, rich in nutrients. Hit the subscribe button and ring the bell icon so you will not miss my upcoming videos. Try to rest. Lack of sleep is really rough on your milk production. If you can take a nursing vacation, cut back on outside commitments and spend a couple of days doing as little as possible other than relaxing with your baby, resting, eating, and nursing. Of course, this is easier with the first baby. Then when you have older children who also need your attention. Tame stress. While stress may not curb milk production, it can hamper your let-on reflex, which releases milk into your milk ducts and make it harder for your baby to get what she needs. Take care of yourself so that at your best for your baby. Ask your partner, family, or friend to help with other things. Tell overnight guests to wait a few weeks before they visit so you can nurse in peace and establish milk supply. Get support. Seek out other new moms which are breastfeeding and lean on each other. If your mom, friend, or grandmother breastfeed, ask her what helped. If you're feeling vulnerable while you're getting your milk supply established, avoid people who are critical or don't support your breastfeeding or who make it hard for you to nurse. Steer clear of beer and other alcohol. You may have heard the claim that beer stimulates milk supply, but actually drinking alcohol lowers milk production. For example, one study found that after drinking 1 or 2 glasses of wine, women took longer to release the first drop of milk and produce less milk overall. Drink plenty of water. If you get dehydrated, you'll make less milk. It's easy to get busy and distracted with a baby, so keep a bottle of water with you and stash bottles where you usually nurse. Also try to eat food that are naturally rich in water, such as fruits and vegetables. Feed you, feed baby. To maintain your milk supply and your own health, if you are exclusively breastfeeding, you need to get about 300 to 500 calories per day, more than what you needed to keep your pre-pregnancy weight. The best diet for a nursing woman is simply a normal, healthy, balanced diet rich in fruits, veggies, and whole grains. Way to use bottles. Bottle feeding is fine for later on, but in the first few weeks of establishing your milk supply, your baby should do all her sucking, or at least as much as possible at the breast. The baby empties your breast much better than a pump does, so you'll make more milk in response to your baby's signals compared to a machine. Herbal health. Certain herbals are thought by some to have boosting effect. For many women, one is fenugreek, a seed often used in cooking. Another commonly used supplement is blessed thistle. The search isn't clear on whether either of these supplements really stimulate milk production, but they are generally considered safe to take while breastfeeding. Avoid fenugreek during pregnancy because it may cause uterine contractions. Talk with your doctor before using any herbal supplements. Food and breast milk. You don't need to eat certain foods to make more milk. Just eat a balanced diet that includes a variety of vegetables, fruits, grains, proteins, and a bit of fat. Some research shows that garlic, onions, and mint make breast milk taste different. So, your baby may suckle more, and in turn, you make more milk. If your baby seems gassy after you have eaten broccoli, cabbage, or beans, back off of those foods. If you mainly or exclusively pump to feed your baby, then most of the advice is this slideshow applies to you. Also, your milk let down and production are cued by your baby. So try looking at the pictures of your baby, listening to a recording of her voice, or inhaling the scent of her blanket or sleepers as you begin to pump. Massage your breast. Breast massage can help to boost the volume and fat content of your milk. When your baby is comfort nursing, calming and soothing herself more than drinking, massage your breast near the chest and then a little further towards the nipple and wait for your baby to take a couple of swallows. Then massage another area of the same breast and wait for more swallows. Repeat. Check your medicines. Some drugs can affect breastfeeding. Commonly used medicines can make or cut your milk supply include antihistamines and discontinuants, diuretics, hormonal contraceptive containing estrogen, and some weight loss medications. Check with your doctor about alternatives. Find a pro. If you're having a hard time getting the hang of breastfeeding, an experienced non-judgmental professional can be a lifesaver. Consider hiring either a postpartum doula or a lactation consultant to give you an advice on things like lactating on and best nursing holds for you. Sometimes you can find both skills in one awesome expert. Thanks for watching. Subscribe for more. This is all for now. If you have any questions, you can write in the comment section below. If you have any other ways, would love to read them, mention them in the comment section. Thanks for watching.